hear me to do your part for you?
Yes, could you? Okay. Good evening, everybody. Thank you so much for coming. Thank you for taking the time again to spend some time with us to learn about the work that ASAP has been focused on for the last few months. As Jeff said, my name is Julie Abedian, and I'm the Vice President at Columbus Regional Health that focuses on community health projects and lots of programs that are really aimed at our community's most vulnerable people. I'm leading the ASAP treatment team, and our team includes two others who you'll hear from shortly. Our team is working on treatment solutions and on initiatives that require collaboration and working together between healthcare providers in Bartholomew County, like the hospital system, Centerstone, Windrose, Columbus Regional Health Physician Practices, Adult and Child, Family Services, and St. Peter's, Dr. Teddy Sidoris, and many others who are engaged every day in providing healthcare services to people struggling with addiction. So our team, Dr. Terrell and Cheryl Buffo, and I will be focusing on these four bubbles in our remarks tonight. So I need the bubbles. There they are. So, county health system, prescribing practices, outpatient treatment, and inpatient treatment. When we started our work a year ago, we really didn't know a lot, to be honest with you. We didn't know what the needs would be, or what the needs were. We didn't know what the obstacles were, or what the solutions were that we would be proposing. We did know, however, how we were going to be doing the work and how we were going to make decisions. We promised you a year ago that whatever we did, we would make our decisions about filling the treatment gaps based on best practices, that we would avoid duplicating services to ensure that treatment is available to everyone, and that we would seek external funding first when possible. So in other words, we wanted to have the best, most effective treatment available to everyone who needs it. And we knew we couldn't go it alone, that we would need partners throughout our region and at the state and national levels. In October, if you were here, we shared our best guesses at what this would mean. But they were halfway informed guesses at that point, I'll just be honest. So we wanted to have expert advice. And so we reached out to the nation's expert on addiction treatment, Hazelden Betty Ford. And I want to take a moment to thank two people who really encouraged us to consult with them. That would be John McGinty and Charlie Wells. They have been devoted admirers of Hazelden Betty Ford for a long time. And then when we got involved with this, they were encouraging us to learn from the people who do this work the best. And so we ultimately ended up doing that. And thanks now to our engagement with Hazelden, we now have a treatment and recovery roadmap validated by the nation's best thinkers and doers on addiction treatment and recovery. Our Hazelden partner, Jordan Hansen, is actually here tonight. And Jordan, would you stand up and so everybody can see you? And thank you. We really appreciate it. Jordan has been wonderful to work with. He knows this world very intimately. He's got a lot of expertise. He brought a lot of his knowledge that he has gained through working at Hazelden for a long time and traveling the nation trying to spread the word about what best practice is when it comes to treatment and recovery. And so we, Bartholomew County, are going to benefit over the long run from having his and Hazelden's expertise. So all the treatment and recovery specifics that you're going to hear about tonight from the treatment and recovery teams are based on best practices, as we promised. And they've now been validated by our friends at Hazelden, so that you, our community in Bartholomew County, can rest assured that the investments that we're going to be making in treatment and recovery resources in our community will have the greatest odds for success. So I'm going to turn things over now to Dr. Kevin Terrell, who is the ASAP physician lead. And Kevin? There he is. Okay. I'm going to give you this. Took me a while to figure out that's what it was.
All right. Well, thanks so much, Julie, and thank you to all of you for coming out this evening. When you have an event like this, you never know what kind of turnout you're going to have, and so I'm always, I'm thrilled to see this number of people there. Thank you for your support. We certainly couldn't do it without you. I am an emergency physician. I worked in the Columbus Regional Health ED for about 7 years. I am the physician lead for ASAP and the Columbus Regional Health Chief of Staff elect. We had 30 overdoses in our community last year. 30 overdose deaths last year. That's one overdose death about every 12 days. That's also about 2.5 times more deaths than we had the previous year. As you can see, this trend is not one that we want to continue. And so we're working toward wiping out that trend and getting it where it was, even better than 2015. We also know that 75% of people who use heroin started with opioid pain pills. They may have gotten those pain pills from a variety of sources. They may have gotten them from friends or family. They might have gotten them on the street through purchasing them. What hurts me is that they may have also gotten them from a well-intentioned physician who was just trying to alleviate their pain and suffering. And so pills are really the fuel for this epidemic. And it isn't all physicians' faults. There are a variety of things that led to this. I'm not going to get into that today, but the point is we have to dry up that fuel for this opioid epidemic. We know that doctors are continuing to overprescribe. We know that 60% of people, when they receive a prescription, have leftover pills, and they just don't throw those away or dispose of them properly. 60% of people hang on to those, just in case. Just in case they get another ankle sprain, just in case their back hurts, they get a bad headache, or whatever reason. More concerning, about 20% of people don't just hang on to those pills, but they share those pills. What we're doing to address this with respect to pain management is that we've assembled 4 work groups. Each of those work groups consists of physician leaders who work in the places that are most likely to prescribe opioid pills. So we've got physician leaders from the emergency department, we've got physician leaders from the inpatient arena where people work in the hospital, doctors work in the hospital and administer opioids and then prescribe opioids at the end of the hospital stay. We also have primary care physicians who work in the outpatient or ambulatory setting, as well as surgeons who prescribe opioid pain pills after people have a procedure, whether it's a tubal ligation, appendectomy, hip replacement, or whatever it might be. But we aren't just working with doctors. We're also working with nurse leaders who are experts in these areas of care. We're working with a Lean Sigma black belt, a medical librarian, and others to really be sure that we're doing this right. So each of these work groups has been charged with identifying pain management protocols, order sets, to use within those environments. As Julie suggested, these are all based on best practices with the goal of 1, alleviating suffering, but 2, and just as importantly, doing it safely. We don't want people to turn into, people who have problems with opioids. And so we want to try to knock out this fuel while we can. What we're doing with all of those pain management protocols is we're going to insert them into our electronic medical record, and then after we do that, every doctor who works within our health system will have those pain management protocols at their fingertips. So the next time a person comes in the emergency department with a broken bone, there will be recommendations for how many opioids are appropriate for that type of broken bone. That will help give opioids only to the right people, and also try to appropriately give the right number of tablets for each patient. We're not so insular that we're just working within our health system. We want the rest of the community to thrive as well. And so we're going to work with physicians who don't work within Columbus Regional Health. We also know that dentists and oral surgeons and probably other providers prescribe opioids. We're going to take what we learn and share it with them. We're going to work with them with the hope that they will engage with us, to embrace what we're doing, and utilize what we've learned. May need to modify it based on their specific circumstances, but we want to share it. As Julie said, we want our community to be the smartest and best at pain management and opioid prescribing safety. I would bet that everyone in this room has an opinion on MAT. I would bet that all of you have heard about it, you've all thought about it, you've heard a variety of things. I'm not here to, spend a bunch of time talking about it, but I want to introduce MAT and share a couple key concepts. The first important concept is MAT is not just medicine. MAT needs to be accompanied by behavioral therapy and social support. I will say that medicine isn't right for everybody. Not everyone who has opioid use disorder needs it. There are some people who are able to get away from opioids and stay away from opioids without medicine. But most people, it turns out, do need medicine to help reduce cravings and for the other reasons that I'll get into shortly. There have been 3 medicines approved for opioid use disorder. They all have different rules and regulations around their use, and each of them works a little bit differently. Cognitive behavioral therapy and coping skills are 2 critical features of the behavioral therapy that people need to help stay away from opioids and to make good decisions. People also need friends and family. Unfortunately, many people who have opioid use disorders have alienated themselves from their family members. And so people who are in that circumstance probably need to go to some place that's a 12-step program such as Narcotics Anonymous or others. The reason I'm an advocate for medications is that medications reduce craving. They reduce this incessant thinking of, when am I going to get my next pill? When am I going to be able to get my next dose of heroin? It allows people to get to a normal state of mind so that they can function, so that they can be contributing members of society. As I'm implying, it's more about the community, or as much about the community as it is about the individual. So folks who are on MAT, they are more likely to be productive citizens. They have improved social functioning. They can get jobs. They hopefully reconcile relationships. But more importantly for the community is that these folks have reductions in their criminal activity. They have a less likelihood of death. They have fewer overdoses, and there's less hepatitis and HIV transmission when MAT is implemented. All of these things are very clearly important for the community. So a few points that I'd like you to walk away from with at least my part of this are that I'm not looking to take away everybody's pain pills. There are many justifiable reasons to prescribe opioids. It's just got to be the right person for the right condition and for the right duration. We're also working with our providers, as I mentioned, to develop safe and effective pain management practices. Third, MAT is safe and effective. That's been proven, and it also is just much more than just medication. It's the behavioral therapy piece of it and the social support that are key ingredients as well. Another final point is that MAT, there are a few areas within our community where a person can get MAT, but we need many, many more. Thank you. Next up is my friend Cheryl Buffo. She's going to talk about some additional things that our treatment team is doing. Cheryl?
Thank you, Kevin. Good evening. Get organized here. All right. So at this one-year milestone of working on and addressing this crisis, there are a few things that we know about substance use disorder and their treatment. Waiting for a loved one to hit rock bottom in hopes that they will be ready for treatment can be deadly. Our community's mindset and treatment strategy need to address this tragic reality. Where treatment is concerned, one size does not fit all. Every person's situation is different, and we need to provide many avenues and entry points to substance use disorder treatment. Returning to the use of illicit drugs or alcohol is a common part of a person's recovery journey. As Dr. Terrell just stated, we know a person's chances of success are greatly improved when treatment with medication combined with ongoing counseling and support services. Outpatient treatment is readily available and expanding in our community. For those suffering with addiction, a number of treatment options are currently available. We are grateful for outpatient services that are currently being provided by Centerstone, St. Peter's, Dr. Teddy Sidoris, and others. Outpatient treatment options are expanding as well. Dr. Sidoris became a board-certified addiction specialist in February and will soon be able to greatly expand her practice. The state of Indiana is adding 5 new treatment centers by June of this year, and 2 of those will be in Greenwood and Bloomington. And then they also just announced new legislation that they're going to be adding 9 more new centers throughout the state within the year. Additionally, new providers are opening office-based practices to increase treatment capacity in our community. We know that we need more, and increasing outpatient capacity is a goal for 2018, and Julie will talk more about that shortly. Residential treatment is available and expanding as well. For those suffering with addiction now, residential treatment options are currently available at Fairbanks, Valley Vista, Terra, Harris House, Wheeler Mission, Harbor Lights, Hickory House, and others. Centerstone has expanded their residential treatment capacity for men in Richmond and Bloomington, and for women in Bloomington and Scott County. They will soon be adding more treatment beds in Columbus as well. We're excited about a new program that's being offered by Indiana Family and Social Service Administration called Open Beds. And it's a program where a treatment provider can call 211 and find available treatment beds in Indiana real time based on the specific need of the person seeking treatment. However, this new system has also identified a major gap in treatment access for many, and that's insurance. With the help of 211, we are finding that there are often treatment beds available for people in these facilities, but a lack of insurance is a barrier to access for many people. So addressing this issue is going to be a priority for ASAP in the coming year. We were also really pleased when we talked to Dr. Walthall today to find out that it's going to be a priority for her department as well. So for tonight, what I'm really excited to share with you is our progress on the partnership that we have with Volunteers of America. VOA has a purchase pending on a building on Washington Street for a residential treatment center for women who are suffering from addiction, and these women they are either pregnant or they have children who are at risk of being placed in foster care because of mom's addiction. So the Fresh Start Recovery Center in Indianapolis was just recently in the news.
Moms out there that are so afraid they're so afraid to reach out because they don't have anywhere to take their children.
I'm Erica Fly. Thousands of Hoosiers face the battle against opioid addiction, and some of them are pregnant moms. But there's a recovery center right here in downtown Indianapolis to help those mothers. RTV6's Nicole Griffin with One Mother's Mission to Sobriety.
Tonight, there are women here at the Volunteers of America building in downtown Indianapolis that are taking part in the Fresh Start Recovery Program. These are moms who were pregnant and addicted to drugs. I talked to one of those moms who actually was able to get clean after many years, but she tells me there was a tragic event that happened in her life that actually caused her to turn back to drugs.
My mom started giving me pills when I was 13 years old.
Years of addiction started at an early age for Laura Bratton.
So I've been on stuff my entire life until 2016. It's the first time I got sober.
But unfortunately, her sobriety didn't last. Bratton is now one of dozens of moms currently in treatment at Fresh Start Recovery, along with her newborn baby boy, Raylan.
May 28th, 2017, I got married. I was married for about a month, and he passed away from overdose on heroin. I lost it. When his heart stopped, I ran out of the room, and I was ready to die. I wanted him to kill me. I mean, I was done.
And the very next day, that's when she found out she was pregnant.
This is his baby.
Bratton says she started using again until January when she checked in to Fresh Start Recovery.
She was able to start her recovery process, her addictions treatment, when she was pregnant.
During the addiction treatment program, the goal is to prevent opening a case with the Department of Child Services and help addicted pregnant women have healthy babies.
What happens is when they give birth to babies that test positive, there's an open DCS case, and those babies oftentimes do not go home with the mother. They end up in foster care, etc.
I am grateful that I got to bring my baby here and that I was able to get help in time so that I knew that my baby was going to be safe and healthy.
Bratton says she gets to focus on her treatment at the same time as she gets to bond with her baby. Nicole Griffin, RTV6.
Fresh Start Recovery now wants other mothers who are struggling with addiction right now to know this is an option for them. Call them if you need help or you want to make a referral.
So we're thrilled to be bringing this evidence-based best practice to our community. The Fresh Start Recovery Center in Indianapolis consistently has about 100 women on their waiting list at any given time. And generally, about 25% of those women are from our area. So the Fresh Start Recovery Center in Columbus will be able to house up to 23 women who can be joined in treatment by up to 2 of her children under the age of 5. And VOA is working toward having the program, the treatment center here in Columbus, open by the end of this year. 2 of our partners from Volunteers of America are in the audience this evening: John Von Arx, President and CEO of Fresh Start Recovery, and Rachel Halleck, Senior Director of Behavioral Health. They're already spending a great deal of time in Columbus building community partnerships. Lastly, we know that treatment alone is not enough. People in recovery need years of wraparound services and compassionate support to ensure their success. That's why a community-wide system of support, including recovery programs, sober housing, and harm reduction services, is critical to a person's successful recovery. We are very grateful to our neighbors at Turning Point and the Lincoln Central Neighborhood Family Center, who have already stepped up to offer their many support programs to the women and children who will be in Fresh Start Recovery. In the near future, there will be many ways that community members can partner with Volunteers of America to love and support these women and their babies. Now Julie's going to share more about some of the other health system projects that we're working on.
So just to reorient, we are talking about this part of the system of support, the county health system. Dr. Terrell talked about the prescribing practices. Cheryl talked about one new inpatient residential treatment center. And I'm going to share with you the progress that we're making on some additional services in both the outpatient and inpatient treatment realms. So projects in progress. We shared with you in October that CRH, Columbus Regional Health, had decided that we are going to be opening an addiction medicine specialty clinic within the Columbus Regional Health System. We want you to know that that work is continuing. It's complex to open up a new practice, especially a practice that we don't have a lot of experience with. So we are very committed to learning as much as we can about what would be the best kind of addiction medicine specialty practice to have in place. We know it's going to be a combination of medicine and a lot of the elements that Dr. Terrell mentioned, the behavioral therapy, the supports, and we are really looking forward. We've started conversations with our community mental health partner, Centerstone, about how we can work together on implementing this addiction medicine specialty clinic. And what that will mean is it's another kind of specialty clinic that our primary care physicians can refer their patients to who are struggling with addiction. We hope that this clinic will be up and running by the time that Fresh Start Recovery is up and running too. We know that when moms go into the treatment center, that when they come out, they're going to need to be supported. So at the very least, we want to be ready when they're here. And we've got a new population of moms in recovery. We would love it to be sooner than that, but it always takes time to open a new practice, and we want to be sure that we're doing it right and we're getting the best people in the practice. Other things that are happening and in progress, no longer theoretical, but actually happening, is Centerstone has received a grant to have recovery peer coaches in the CRH emergency department. They have just informed us in the last week that they've hired their first recovery coach. And not only is the recovery coach going to be located in the emergency department, but also this person is going to be available for any other patients throughout the hospital who may be ready to be considering treatment, or entering recovery. And so the idea of having a recovery coach is to have a person who is a peer, who's somebody who is in recovery themselves, long-term recovery, and has special training to engage with people at the moment when they might be ready to consider taking a different path. And so we're really excited to be working with Centerstone on this project. And we're hopeful that by midsummer we are going to have our recovery coaches up and running. We think that we're going to start the program in May, and that we'll be fully functioning and humming along by midsummer. Also, we shared with you last time also that Centerstone had opened a treatment center for women down in Scott County. That we consider that our region. Providers locally will be able to refer women to into the Centerstone residential facility. This is a treatment resource for women without children. So they fill a different niche than what VOA is going to serve locally. Additionally, Centerstone, since we last met, has announced that they are going to be opening another residential treatment center in Bartholomew County. And we're awaiting the details on that. They've got some decisions to make, but we're very excited that they are going to be able to provide additional treatment beds right here within Bartholomew County. Projects that are under development. So the first three that I mentioned we're really making good progress on. The next few that I'm going to talk about are still under development. We want to have in our community an integrated primary care and behavioral health practice. And we're running into some roadblocks and taking some twists and turns with this one, but this is a model that we have studied in other communities. We had a group Go to Decatur, Illinois. They've got a wonderful example there that we would like to replicate here if we can, to have an integrated primary care and behavioral health practice right here in Bartholomew County. Also under development is to have what's called medically managed withdrawal and or induction at Columbus Regional Health. Some people call this detox. That's kind of a catch-all phrase. It doesn't really differentiate between the different kinds of ways to enter recovery, but the idea here is that we need to be able to, when people present at the hospital who are actively needing treatment, that we have the resources in the hospital to be able to start them right at that moment onto their path of into recovery. We need to have these other resources in place to do this piece of it. A lot of these treatment resources are sequential, and but we are, once we get our addiction medicine clinic up and going, and once we have additional primary care resources in place, and once we have more treatment beds available, then we will have places for people to go if they come into the emergency department overdosing and ready to be entering into treatment and recovery. So our goal is to have the right treatment available at the right time in all of the right places. And the health system is one set of places where treatment needs to begin and treatment needs to happen. And we want to have as many resources as possible within our county's health system